My name's Karash. I'm a design engineer for Stryker Medical in Portage, Michigan. We do ambulance cots, beds, stretchers, anything that a patient will go on and be transferred from, when they're hurt all the way to the hospital until they're treated and have to be in a bed for a little while. Anything they're laying on is what we do. I think about 5-6 years ago, our cots were rated for 500 pounds, and now they're actually increased to about 700 pounds. And one of our latest products that's actually doing very well is a hydraulic lifted cot. Average patient now is about 500 pounds being transferred in ambulances. So all these physical constraints are weight. So, EMTs are going to be lugging this around from their ambulance to the patient's house. Not only their house, but they could be in a field. So anything that has to roll well, it's got to be small enough to be able to go through apartment buildings. And in addition to that, it's got to be able to hold the largest of patients as well. We've had the same side rail for now almost 20 years. 93, I believe, is when we started making cots. And they are an old design where it was a side rail that would be scissored actioned up along the side in the same direction as the patient lengthwise. Pinching is a big issue for people that have excess skin, excess fat along the sides. So a new side rail that we're working on is a folded one where it would scoop the patient as it's lifted up from the sides and kind of hold them in so they're more comfortable when they're being transferred to the hospital. So this side rail, our main focus was comfort as well. So we made sure through ID and everything, and a lot of voice to the customer, we came out with a side rail that was pretty much a flat sheet on the section that's actually in contact with the patient, and all the controls and everything are on the outside for the EMT to use, so that when you have to transfer the patient or when the cots come up and actually contact the patient, it's nice and smooth where they put their hands. There's very little sharp edges there. We have to make sure there's no parting line edges for their hands to get cut on. But everything on the outside is accessible and easy to use for the EMTs to lower it and raise it up as well.